like I did with my auricular acupuncture video that I did a while back, I recently got an epidural steroid injection for my lower back pain. And lots of people who have lower back pain are treated with epidural steroid injections. They even just call them ESI. And of course, me being me, before I went to have this procedure done, I did all kinds of internet research on it because that's just how I do things. I can't go into something if I don't know what's going to happen. I tend to panic. So I like to go into something with the notion that I have some idea what's about to happen to me. And most of what I read on the internet didn't really match up with my experience. So I'm just going to share with you, both here on the YouTube channel and with my people in my life, what it was like when I went to get my steroid injection. So I'm just going to describe that process. So for those of you on my YouTube channel, nice little trigger warning for you here, I'm going to be in relatively graphic detail describing what this procedure was like. So if descriptions of that sort of thing with needles and epidural kind of stuff, if that kind of thing is going to upset you, this is not a video for you. However, I'm just going to go in and I'm going to talk from beginning to finish about exactly what happened and what did not happen during my steroid injection procedure. And I have another one next Thursday. So anyway, I'll get into it. The first thing I have to say is that it appears that I may be one of the fortunate 50%. With ESI treatments, everything that I've ever read, or doctors who have talked to me about it said that it's usually about 50-50, that half of the people who get these injections get no pain relief at all, or it's very, very short-lived. And of course, this was only done last Thursday, and I have another one next Thursday, so we really don't know at this point how long-term my relief is going to be. But what I can tell you is it has been long enough since I got the shot now that there's no more of that anesthetic in there. So, I mean, the Lidocaine is all gone, so that's not the reason I'm feeling better. And I have not had to take a painkiller of any kind or any anti-inflammatories or any muscle relaxers since I received my shot. I'm feeling better than, honestly, I've felt in years. Post-shot. And they told me that this would happen, and so I'm not quite out of the woods on that yet. You know, we're going to have to wait a while to see how effective it was. But so far, all signs are pointing to this is going to be a really good thing. I don't know how long it's going to last, but hopefully it'll last a little while because it's been really good. You can probably tell just by looking at me. I look better. I haven't been in pain. It's been, several days. I'm practically... I can't even really register pain right now. I feel kind of pain-free, really. So that's the best part, and that's the best news so far, and knock on wood, that will continue. Cadence has joined me, so there's going to be some doggy noises in the background. As with any surgical or pseudo-surgical procedure, there was a fasting period. With this procedure, it was 6 hours rather than 12, so it wasn't that bad. Basically, you just don't eat after you get up in the morning. And the thing was, you couldn't drink anything either, so I was dying of thirst by the time I got out of there. That's the one thing I remember, is just being parched. And so when they asked me how I was doing afterwards, I was like, can you please bring me some water? So hydrate really well the night before you get a procedure like this if you're going to have one of them done. So basically the way it worked is they called my name and they took me back to the procedure room, which was just a surgical bed, and then they have monitors up there because this is a procedure that is guided by X-ray. So there's an X-ray thing that comes down over you, like kind of like in the same position they would put a lamp or something right over you, because they take X-ray pictures to kind of guide the person, as opposed to, something like you would see with the laser or laparoscopic or whatever, where there's a live feed. Instead, they use X-rays photos to guide the physician doing the work. So basically, you go in there and they have you lay, at least for the lumbar spine. I don't know what the position would be for a different area, but mine was in my lower lumbar spine. My L4, L5 was the space they were using. This is skipping, so I'm going to start a new clip. So I'm lying face down on this table, and you can't really see anything from that position because you're literally flat on your stomach with your face down. And so one of the nurses just kind of unceremoniously pulls my pants down. And so I spent the next 20 minutes, with my bum hanging out in front of God and everybody, and that was the most jarring and uncomfortable part of the procedure for me, because I don't think I was fully prepared for that. I mean, I don't know what else I thought they were going to do, but that was, it's like, whoa. So I was laying face down, couldn't see anything around me, naked from the waist down, and, you know, the door opens and closes, and you're like, who are they letting walk in here? You know, that kind of thing. So that was a little bit undignified, but I got over it. And I didn't have too long to worry about that before they shocked me with something else, and that was, you know, the application of betadine, or whatever the sterilizing solution is that they were using, you know, the ugly dark orange yellow stuff. And, you know, I knew they would use some of that because it was a sterile procedure. But they basically gave me a bath in it. I mean, everything from about the middle of my back to my upper thighs, and it was everywhere. It was all over the place. And that was why they tell you to wear clothing that you don't value to this procedure. And I had followed instructions on that, but I thought it was just, you know, for comfort, because the way that they had characterized it, I thought they were saying wear comfortable, loose clothing, you know, so that's what I had done. But no, it's because basically anything that you have, they're going to end up splashing that betadine solution all over everything that you have on. So yeah, it was everything from the middle of my back, I would say, down to my upper thighs was completely hosed down with betadine. Which was very cold and a little bit shocking, but, you know, obviously doesn't hurt. And then we got to the only part of the procedure that I would characterize as, holy crap, painful. A lot of people who've had anything medical done, you know, because they use this, you know, they use topical anesthetics or local anesthetic in lots of different kinds of procedures. So if you've ever had a mole removed, or if you've ever had, you know, I think they use it for removing warts and things like that, but lidocaine. Lidocaine can be applied topically or subdermally, you know, like with patches and things like that. But the best thing I can compare it to is when you get a Novocaine shot at the dentist's office, only that is nothing compared to the lidocaine shot that you get for an epidural steroid injection. There was a lot of lidocaine applied, and lidocaine shots sting. But they're usually pretty short-lived, right? You're not usually being continuously injected with lidocaine. But this obviously was very deep. They were actually going to insert an epidural needle all the way into my spine. So there was a lot of lidocaine. And the lidocaine shot hurt like a bitch. I'm not even gonna, I mean, I had the most trouble keeping it together for that. I wasn't really prepared because I've had lidocaine shots before, and it's like the bee sting. You basically just grit your teeth, put on your big girl underwear, and then you just deal with it for a couple seconds, and then it's gone. This lasted a little bit longer, but it was necessary because they had to deaden the entire area, obviously, so that I wouldn't be in excruciating pain during the procedure itself. So the lidocaine part, awful. But it really didn't last that long. And so, you know, I think that most grown-ups could handle that with, you know, you can get through that. But it was awful. I'm not looking forward to that part again, because that's going to happen again next Thursday, and I'm not looking forward to it. But then the real procedure begins, and this was where I was a little unprepared for how all of this was going to go. Because on the internet, a lot of people talk about being sedated before they were given their injection. That was never offered to me, and quite frankly, I'm glad they didn't, because I don't like being sedated. I don't like general anesthesia. I don't like the feeling of losing control. I don't like narcotic sedatives that kind of, you know, I think they call them twilight. I had an upper GI in my early 20s where they put a tube down to look at something in my stomach, and they gave me Demerol for that, you know, that puts you in like a twilight state. I think they use ketamine in hospital settings for some kinds of procedures like that, where you're conscious, but you're so out of it you don't really know that you're there. And so I'm really glad that they did not offer that to me. I don't think that it's necessary for this procedure, because other than the lidocaine injection part, none of it was painful enough that I think it would have been worth both the risk and, for me, the recovery time and how bad you feel after you come down off of one of those sedatives. So I'm glad they didn't offer that to me, but apparently some people who do this, some doctors who perform this procedure, offer to sedate their patients. I was not sedated. I was completely conscious and completely in my right state of mind the entire time that I was in there. And so I guess now all that remains is to tell you what they did and what that felt like. Once the procedure started, it was actually over relatively quickly. My husband said that I was gone from the time they took me away from the waiting area until the time that they wheeled me out for him to drive me home was like 20 minutes total. And most of that time, honestly, was prepping me and getting me numbed up. And then the only other part that took any consideration of time was the doctor then had to place the needle in the appropriate place to give me the injection. And that's the part that's guided by the x-ray. And they use, she began by, inserting the needle, which I didn't feel at all because the lidocaine had completely numbed up the area. So I did not feel the needle at all. And then basically they go in, and when she feels that she's very near the space, they will start injecting a dye so that they can see it more clearly on the x-ray. And then they will take a short series of x-ray photographs as she is positioning the needle so that she can confirm for absolute certain that the needle is exactly where she wants it to be in the disc space to deliver the steroids and whatever else is in that cocktail that they inject in there. And so that took a few minutes, but it wasn't uncomfortable. I felt no pain. And basically the only thing that was jarring for me as the patient was, they want you to be extraordinarily still. And so you're sitting there with heightened consciousness of the fact that someone is poking around in your spine and that you don't want to jerk, you don't want to move, that sort of thing. So all of a sudden, it's like all of a sudden you feel this phantom itch or this phantom tickle in your throat, and you're like, oh my God, I'm going to cough, I'm going to sneeze, I'm going to do something, or maybe that's just the crazy in me. But as the patient, these were the thoughts that I was having while that part of the procedure was going on, because I felt nothing during any of that. I would hear the doctor giving instructions to her tech for pictures or what have you. But that was the only thing that I felt or was conscious of going on around me. I was concentrating very hard on the constant admonition not to move. Stay still, you're doing great, be really still, you're doing great, was basically the mantra that was going on as they spoke to me during all of this. And then the doctor informed me that the needle was positioned correctly and that they were going to start the actual injection. And this part I could feel, but it wasn't nearly as bad as I was scared it was going to be. You and I both know that when a doctor says, okay, you're going to feel a little pinch, or you're going to feel a little pressure, that they're lying, right? Almost every time a doctor has ever said, you're going to feel a little pressure, that meant I am about to cause screaming pain to you. But in this case, pressure was absolutely the correct word to use. That's exactly what it felt like. The only thing I can compare it to is it felt like something being stretched. And it was uncomfortable. It didn't feel good, but it did not hurt. I swear it did not hurt. When they started injecting the cocktail of steroids and whatever else was in that shot, she began explaining to me, this is what you should feel. If you feel any shooting pain, if you feel any sharp pain, I need to know immediately, that sort of thing. And I did not. She had positioned the needle correctly, and so I didn't feel anything I wasn't supposed to. And in the lumbar area, because this was a treatment for sciatic pain and my nerve root was very irritated in the right leg, she was telling me you're going to feel a buildup of pressure at the site of the injection, right in the middle in the back of your spine, and you're also going to feel pressure that's going to kind of move down almost to your knee. And she said, if you feel anything else other than that, I need you to tell me immediately. And all I felt was pressure. It really did just feel like a squeezing kind of sensation, and it did not feel good, but it did not hurt at all. And that went on for, I don't know how long it actually was on the clock. It may have been as quickly as a minute, but it felt like 5 minutes or so that I was sitting there dealing with that. And then as soon as that was done, it was all over. She removed the needle after that, and it was one of those shocking things. She was like, okay, it's all done. So really the lidocaine and the being naked in front of people I don't know was the hardest part of it for me. The actual procedure itself was not painful. It was not traumatic. My doctor was very good. She has a very soothing voice. She's this stunningly gorgeous, slightly chunky, but just something about her. She's just a beautiful woman, and it's something about the roundness of her face. I think that were she slender, she wouldn't be quite so beautiful. You know, she's just one of those unique people where you can't stop looking at her because she's so pretty. And she had a beautiful, calming Indian accent, kind of tickled by the American accent. It was interesting. So her voice was so soothing. Seriously, I could have listened to my physician read the phone book to me, and it would have made me calm. So I had this excellent feeling about my doctor, and she was very, very good to me. And she's very proficient at what she does. She does a lot of these injections, and so she definitely knew what she was doing. She had me in and out of there very quickly. The only other part of it that I found disconcerting was, of course, then the nurses and the radiology tech who was in there helping her, they started cleaning me up. And I don't think that I've had anyone assist in cleaning that part of my body other than me since I was in diapers. So that was a little disconcerting to have a grown adult standing behind me with, you know, warm towels cleaning betadine off my bottom. So again, you can tell that I kind of had a hang up with my naked bottom being out in front of everybody. It was not comfortable. But then that was it. And they gave me a drink of water, and they put me in a wheelchair, and they gave me back to my husband, and that was it. And I have felt that first day, it was a little achy. I think probably just because it irritated it to have extra volume added to that area. But it was overall a very positive experience. It was not scary, any scarier than something that like that would be for anybody who's having it the first time and doesn't know what's going to happen. In closing, basically, I wanted to tell people, because I know there's probably people out there who are considering getting this procedure, or people who were just curious how it went for me, and I wanted to describe it because it was, you know, obviously been kind of a big deal in my life. I've been scared of it for the last month since I knew I was going to get one, and then, you know, I've been wanting to tell people about it since it happened. It's kind of a big deal for me. But the most encouraging thing to me is that now that we are, you know, what is that? Friday, Saturday, Sunday. We're 4 or 5 days out from having the procedure now. I feel much, much better now than I did in the first day or two afterwards, because my protrusion, I had a herniated disc, and that's why I had this procedure, and it was pretty severely protruded. So I think the steroids are actually doing their function. Now, how long that function will last, we won't know until we get through all of this. And I'm going to have another shot exactly like the one I got last Thursday, this Thursday. They usually give them in groups of 3. My physician, her preference is to do a series of 2 of them in succession, one week, one the next week. And then she waits to see if your pain comes back before delivering the 3rd. Because the way that these are kind of governed is that you're allowed to have 3 of these injections every 6 months. No more than that. I'm sure that there is a medical reason for that. That's some kind of a threshold that they have determined is the safety mark for how many they can give you. So her preference is to see how the patient reacts to the first 2 and then only deliver the 3rd if they need it, or to wait and keep it in reserve so that if the pain returns 3 months from now, they don't have to wait until the 6-month mark has passed to receive another injection. That's the way it was explained to me, and it makes sense. But I feel great. I feel better than I have felt in years. And basically the waiting game now is for me to continue taking physical therapy, which is great. My physical therapist is someone that I knew personally, so I didn't feel embarrassed meeting him for the first time because I actually know him a little bit already. So that was kind of nice. So I'll be doing physical therapy a couple of times a week while I'm, you know, waiting to see how these shots pan out in the long run. But if they continue the way this one is, this is looking like it might be a solution for me. So I'm really, really hoping that it continues in this way. Okay, that was it. That was my epidural steroid injection story. And if you're watching this on the YouTube channel and you're about to go and have one of these, or if you've had some of these and your experience was different, or the way your doctor did it was different, comment below, because I'm very interested. I love to hear about things like this. So anyway, thanks for watching. I will be back on the channel with our usual subject matter. Post haste, I'm going to do a video on the tracking apps as promised this afternoon after I get back from physical therapy. All right, talk to y'all later. Bye.